In this video by Deckplate we will be discussing knee injuries and VA disability, some of the most common knee injuries experienced by military personnel. Knee injuries and VA disability. Knee injuries are relatively common among military personnel, given the physically demanding nature of their duties and training. Some of the most common knee injuries experienced by military personnel include anterior cruciate ligament injuries, ACL tears, are relatively common in the military, often resulting from activities that require sudden stops, changes in direction, or jumps. These injuries can be especially prevalent in training exercises, sports, or combat situations. Long-term effects of ACL tear. Knee instability. ACL tears can lead to knee instability, making it challenging to participate in high-impact activities and sports. Individuals may feel as though their knee gives way during certain movements. Meniscus and cartilage damage. ACL injuries can increase the risk of meniscal tears and damage to the articular cartilage within the knee joint. This can lead to chronic pain and early-onset osteoarthritis. Decreased activity levels. Many individuals with ACL tears reduce their physical activity levels due to pain, instability, and fear of re-injury. Muscle weakness and imbalance. Muscle weakness and imbalances around the knee can develop as a result of the injury and subsequent decreased activity. Diagnosis of ACL tear. Clinical evaluation. A healthcare provider will perform a physical examination of the knee, assessing range of motion, stability, and pain. Medical history. Information about the mechanism of injury, symptoms, and any previous knee issues will be collected. Imaging studies. While not always necessary for diagnosis, imaging studies like MRI, magnetic resonance imaging, are commonly used to confirm the presence and severity of an ACL tear. Lachman test and anterior drawer test. These are physical tests that assess the stability of the ACL and are often performed during the clinical examination. Meniscal tears. Meniscal tears, particularly in the medial meniscus, can occur due to twisting or sudden movements. Military personnel are at risk, as they often engage in activities that involve pivoting or changing directions quickly. Long-term effects of meniscal tear. Chronic pain. A meniscal tear can lead to chronic pain in the knee, especially during activities that involve bending or twisting the knee. Swelling. Swelling of the knee joint may become a recurrent issue, causing discomfort and limited mobility. Knee instability. A meniscal tear can reduce the stability of the knee, making it feel wobbly or unstable during movements, such as walking or standing. Decreased range of motion. Over time, a meniscal tear can limit the knee's range of motion, making it difficult to fully bend or straighten the leg. Arthritis. Untreated meniscal tears can increase the risk of developing osteoarthritis in the affected knee joint. This is due to the loss of the meniscus's cushioning and stabilizing effects, which can lead to increased wear and tear on the joint's articular cartilage. Functional limitations. Individuals with meniscal tears may experience functional limitations in daily activities, exercise, and sports. Muscle weakness and imbalance. The pain and altered biomechanics associated with a meniscal tear can lead to muscle weakness and imbalances around the knee joint. Diagnosis of meniscal tear. Clinical evaluation. A healthcare provider will conduct a physical examination of the knee, looking for signs of swelling, tenderness, and joint stability. Medical history. Information about the onset of symptoms, any specific incidents or injuries, and the nature of the pain will be discussed. Imaging studies. Imaging tests are commonly used to diagnose meniscal tears. The two most common imaging modalities are magnetic resonance imaging, MRI. This imaging test can provide detailed images of the knee joint, allowing healthcare providers to assess the extent and location of the meniscal tear. X-rays. While X-rays do not directly visualize the meniscus, they can help rule out other knee conditions, such as fractures. McMurray test and Apley's compression test. These are physical tests that healthcare providers often perform during the clinical examination to assess for meniscal injuries. Patellar tendinitis. Jumper's knee. Patellar tendinitis can develop from repetitive jumping and landing, which is common during physical training, parachute operations, and certain combat situations. Long-term effects of patellar tendinitis. Chronic pain. Patellar tendinitis can lead to chronic and persistent pain just below the kneecap. The pain may worsen with activities that involve jumping, running, or squatting. Reduced performance. Athletes and individuals with patellar tendinitis may experience a decline in their athletic performance, as the condition can limit their ability to jump, sprint, or change direction quickly. Functional limitations. The pain and discomfort associated with patellar tendinitis can affect daily activities, such as walking, climbing stairs, or kneeling. Tendon degeneration. If left untreated or if the condition becomes chronic, patellar tendinitis can lead to degeneration of the patellar tendon. This degeneration can increase the risk of tendon ruptures, which may require surgical repair. Muscle weakness and imbalance. Persistent pain can result in muscle weakness and imbalances around the knee joint, affecting overall joint stability. Diagnosis of patellar tendinitis. Clinical evaluation. A healthcare provider will perform a physical examination of the knee, focusing on the patellar tendon and evaluating for signs of pain, swelling, and tenderness. Medical history. Information about the onset of symptoms, any specific activities or sports, and the nature and duration of pain will be discussed. Imaging studies. While imaging is not always necessary for diagnosis, it can be useful to rule out other potential causes of knee pain. The following imaging tests may be ordered. Ultrasound. Ultrasound imaging can provide real-time images of the patellar tendon and assess its thickness and structure. Magnetic resonance imaging, MRI, can offer detailed images of the patellar tendon and surrounding structures, helping to confirm the diagnosis and assess the extent of the injury. Functional tests. Functional tests, such as single-leg squats or jumps, may be performed to assess the impact of patellar tendinitis on functional activities. Iliotibial band syndrome, ITBS, can result from overuse and repetitive knee movement. Marching or running with heavy loads, common in the military, can contribute to ITBS. Long-term effects of iliotibial band syndrome. Chronic pain, ITBS, can lead to chronic pain on the outside of the knee or hip. This pain may worsen with activities that involve bending or extending the knee or repetitive movements of the hip and knee. Functional limitations. Persistent pain and discomfort can limit the ability to participate in sports, run, cycle, or perform other lower body activities. Muscle imbalances. ITBS can lead to muscle imbalances around the hip and knee, affecting overall lower limb stability and increasing the risk of future injuries. Changes in biomechanics. Individuals with untreated or recurring ITBS may develop altered biomechanics of the lower limb, potentially contributing to other issues such as knee or hip pain. Scarring and thickening of the IT band. In some cases, chronic ITBS can lead to scarring and thickening of the iliotibial band, making it more resistant to treatment. Diagnosis of iliotibial band syndrome. Clinical evaluation. A healthcare provider will conduct a physical examination to assess for signs of ITBS. This may involve performing maneuvers that reproduce pain or discomfort along the lateral, outer side of the thigh or knee. Medical history. Information about the onset of symptoms, training or activity regimen, and any changes in activity levels will be discussed. Imaging studies. While imaging is not always necessary for diagnosis, it can help rule out other potential causes of knee or hip pain. X-rays or MRI may be used to assess the structures of the knee or hip joint. Functional assessment. A functional assessment may involve evaluating an individual's running or cycling gait, as well as assessing strength, flexibility, and muscle imbalances around the hip and knee. Patellofemoral pain syndrome, PFPS, also known as runner's knee, can occur in military personnel due to the repetitive nature of running and marching. It often presents as pain around the kneecap. Long-term effects of patellofemoral pain syndrome. Chronic pain, PFPS, can lead to chronic or recurring pain in the front of the knee, especially during activities that involve bending or weight-bearing on the knee, such as running, climbing stairs, or squatting. Functional limitations. Persistent pain and discomfort can limit an individual's ability to participate in physical activities and sports, impacting overall fitness and well-being. Muscle weakness and imbalances. To avoid pain, individuals with PFPS may alter their movement patterns, which can lead to muscle imbalances around the knee and hip. This can affect lower limb stability and increase the risk of future injuries. Joint overuse and cartilage wear. In some cases, PFPS can lead to joint overuse and increased wear and tear on the cartilage behind the patella and on the femur. Over time, this may contribute to early-onset osteoarthritis. Diagnosis of patellofemoral pain syndrome. Clinical evaluation. A healthcare provider will conduct a physical examination to assess for signs of PFPS. This may involve assessing pain and tenderness around the patella, observing knee movement, and evaluating muscle strength and flexibility. Medical history. Information about the onset of symptoms, specific activities or movements that exacerbate pain, and any changes in activity levels will be discussed. Functional assessment. A functional assessment may involve evaluating an individual's gait, walking and running patterns, and assessing lower limb alignment, muscle imbalances, and biomechanical issues that could contribute to PFPS. Imaging studies. Imaging is not typically required for a diagnosis of PFPS, as it is primarily a clinical diagnosis. However, in cases where other conditions need to be ruled out, X-rays or MRI may be used to assess the knee joint structures. Bursitis. Knee bursitis may develop due to repetitive kneeling or direct trauma to the bursae, fluid-filled sacs, around the knee joint. Long-term effects of knee bursitis. Chronic pain, untreated or recurrent knee bursitis can lead to chronic pain and discomfort in the affected area, especially during activities that involve bending or pressure on the knee. Swelling and enlargement, repeated bouts of knee bursitis can lead to the bursa sac becoming enlarged or thickened, potentially increasing the risk of future flare-ups. Reduced range of motion, persistent inflammation and pain can limit the knee's range of motion and flexibility. Functional limitations, knee bursitis can impact an individual's ability to perform activities that involve kneeling, squatting, or even walking comfortably. Secondary conditions, in some cases, chronic knee bursitis can lead to overuse injuries or changes in gait and biomechanics that contribute to other knee problems or conditions. Diagnosis of knee bursitis. Clinical evaluation. A healthcare provider will perform a physical examination of the knee, paying attention to signs of swelling, tenderness, and warmth around the bursa sac. Medical history. Information about the onset of symptoms, any specific incidents or activities that aggravated the condition, and the nature of the pain will be discussed. Aspiration of bursa fluid. In some cases, a healthcare provider may perform an aspiration procedure to remove fluid from the bursa sac and assess its characteristics. This can help confirm the diagnosis and rule out other conditions. Imaging studies, while not always necessary for diagnosis, X-rays or ultrasound imaging may be used to assess the knee joint structures and rule out other potential causes of knee pain or swelling. Osteoarthritis. Over time, the cumulative wear and tear on the knee joints in military personnel may lead to osteoarthritis, causing chronic knee pain and functional limitations. Long-term effects of knee osteoarthritis. Chronic pain. Knee osteoarthritis often leads to chronic and persistent pain in the affected knee joint. This pain can worsen over time and become increasingly debilitating. Decreased range of motion. As the cartilage wears away, individuals with knee osteoarthritis may experience a reduced range of motion in the knee, making it challenging to fully bend or straighten the leg. Joint instability. The loss of cartilage can lead to joint instability, which can result in a feeling of giving way or unsteadiness during weight-bearing activities. Muscle weakness. Pain and functional limitations can lead to muscle weakness and imbalances around the knee joint, affecting overall lower limb stability. Functional limitations. Knee osteoarthritis can limit an individual's ability to perform daily activities, such as walking, climbing stairs, and participating in physical activities or sports. Decreased quality of life. The pain and disability associated with knee osteoarthritis can have a significant impact on an individual's overall quality of life, leading to reduced mobility and increased dependence on others. Diagnosis of knee osteoarthritis. Clinical evaluation. A healthcare provider will perform a physical examination of the knee, assessing for signs of pain, tenderness, swelling, and joint stability. They will also evaluate range of motion and joint function. Medical history. Information about the onset of symptoms, the nature and location of pain, any specific activities or movements that exacerbate symptoms, and the impact on daily life will be discussed. Imaging studies. Imaging tests are often used to confirm the diagnosis and assess the severity of knee osteoarthritis. The following imaging modalities may be used. X-rays. The X-rays can reveal joint space narrowing, bone spurs, osteophytes, and other characteristic signs of knee osteoarthritis. Magnetic resonance imaging, MRI, can provide detailed images of the knee joint, cartilage, and surrounding structures. Blood tests. These blood tests are not typically used to diagnose knee osteoarthritis but may be performed to rule out other conditions, such as inflammatory arthritis. If you were discharged veteran from U.S. military and looking for the compensation you can get for the condition of knee injuries and VA disability, please check out our other video on knee injuries and VA disability with compensation rating. Thank you for watching our video. Please don't forget to subscribe and like our videos.